or allowed you to participate in community activities or family activities. You might say, well, that sounds better. But that's really hard to measure. With sensors, we may be able to do that. So all of these issues limit the way we design our trials, they affect the validity of our trials, and they affect the responsiveness of patients or the sensitivity of our interventions to making changes in people's lives. This is an example of an ordinal scale. And so it's a little hard to see, I'm sure, but it's basically called the stroke impact scale. And it asks patients a series of questions and asks them to say, well, things more difficult, less difficult, about the same in difficulty, for example, for climbing a flight of stairs or walking one block or moving about the house. So this kind of ordinal scale on top of, say, that walking speed increase of 50 feet may provide some insight into whether your patient's really better from that intervention. But there's still a long ways from what people are actually doing. And I talk to patients all the time who sit there and tell me that they're doing those things I ask them to do, and their spouse looks at me and goes, what are you talking about? You don't do anything. You know, you're not practicing your walking. You're not practicing your reaching skills. You're not taking your medication on time. You're not improving your fitness, that sort of thing. So with the UCLA Wireless Health Institute, set out to try to deal with patients who are disabled. So they have unusual movements. Their purposeful movements aren't easy to characterize. And this became a wonderful challenge for my engineering colleagues who never once said that there was any chance they couldn't solve the problem. They just said, you know, okay, great, tell us what the problem is.